This is 41 Today on 41 NBC.
Good morning and welcome back. Today we have Rogerio Lilenbaum from Atrium joining us. Thank you for being here today.
Thank you, Monica. Thanks for having me.
I'm glad to have you here. We have a really important topic today, lung cancer awareness. Why is it so important that we talk about lung cancer?
So lung cancer is the leading cause of cancer death in the United States, and it has been for decades. It's not the most common cancer. Breast cancer is the most common one in women, and prostate cancer is the most common cancer in men. But lung cancer is responsible for more deaths on an annual basis than those two plus colorectal combined.
Wow. I want to talk about this. You know, lung cancer is very relevant. It's something that we need to talk about, but there is hope, and we talked about that before. Technology has really helped out. What is lung cancer like now versus maybe in the past? What resources are available?
Absolutely. So when I started my career as a lung cancer doctor, we had very few tools to offer our patients. Most patients were diagnosed at later stages of their illness, and we did not have the ability to provide treatments that would make a meaningful difference in their longevity or quality of life. Fast forward 2.5 decades, we're in a different place today. We're able to diagnose lung cancer at earlier stages, way more frequently than before. We have revolutionary treatments, including certain pills, oral drugs, that can be taken that will target specific genes in the tumor cells that drive the growth of the cancer. And of course, more recently, as everybody sees on TV, the immunotherapy drugs, the drugs that are able to manipulate your immune system to fight against cancer cells. And those drugs have absolutely made a difference with a much larger percentage of patients alive after the diagnosis of lung cancer. In fact, it's important for you viewers to know that lung cancer mortality has decreased significantly over the past decade. So there's a lot of hope ahead of us.
And in addition to that hope, a new resource at Atrium. You guys have a new resource to kind of help this problem even more. What's going on?
We absolutely do. We really are in the cutting edge of lung cancer, both research and clinical care. The ion navigational bronchoscopy is a new technique that the pulmonary doctors, the lung doctors, can use to access and reach small lesions that are in the periphery of the lungs that otherwise cannot be reached by other techniques. In many cases, up until recently, the patient had to have a needle put through the chest to reach that spot, with the risk of leaking or causing some air into the lung. Now it's done much more safely and much more accurately. So it's really a fantastic diagnostic tool.
That really is incredible. And so I want to talk about it. When should people be getting tested, and what symptoms are we looking out for?
Yeah. Let me take the latter part of the question, which is it's usually a combination of chest symptoms, cough, chest discomfort, shortness of breath, something new that doesn't go away. And then at the same time, some patients, many patients in fact, will have general symptoms. They don't feel they feel weak. They feel like they don't have the same energy as they had before. They start to lose their appetite and lose weight. So those symptoms, both specific to the chest and general symptoms, are typical of lung cancer patients, and they should seek medical attention if they have those symptoms. For patients without symptoms who are at risk for lung cancer, especially former smokers, we now have lung cancer screening. Just like we have breast screening with a mammogram or colon cancer screening with a colonoscopy, we have lung screening. It's a very fast CT. It does not take contrast, and it's able to detect early lesions in patients who are more likely to develop lung cancer. It's a terrific tool. It has helped tremendously in finding more early stage lung cancers. But we're not capturing everybody who is eligible for the study in the United States. In fact, I would say only 1 in 5 patients who should take that test has currently had it. Wow. So we need the primary care docs, we need the pulmonary docs, we need you all to help us steer patients in the right direction and ask their physicians, should I have a lung screening scan?
And at what age should they start that?
It's from 50 to 80, and it depends on how much you smoked in the past.
All right. If you have any questions or would like to learn more about lung cancer awareness, head on over to our website, 41nbc.com.
Get news anytime on 41nbc.com and the 41NBC News app. 41NBC. Clear, accurate, to the